Good morning to everybody, Royal Highness. Thank you for coming here to join us. And thank you to everybody for attending this session. We are going to talk today about healthy cities for healthy population. And we have a set of very outstanding speakers who are going to join the stage in the next few minutes. And I will simply my name is Roberto Bertolini. I'm advisor of the Minister of Public Health here in Qatar. And I would like to give you some little background of this work. And before doing so, I would like to acknowledge the great collaboration that we are having with both WISH in preparation of this session and in general terms, and also with Qatar Foundation, which is very much involved in the activities we are doing in this particular area, in different domains actually, including the policy hub and other type of activities. Now, we link to this healthy population document of the WISH 2016, which actually gave some general directions to what would be the main recommendations, the main recommendations to promote healthy populations at the city level, at the local level, and in general terms. As you can see here, understanding the problem, focus on all determinants of health, generate shared accountability for improving population health, empower people and communities, and embed health equity as a core part of the population health strategy. Now, what we are going to focus here today are on two or three aspects of this one. First of all, the healthy city concept. This is just a summary of what the healthy city concept is. So it's a way to ensure the improvement of the health of the population through an integrated approach among different sectors involved in that. And we will have a presentation discussing this. And in addition to that, this healthy city approach is basically an application at the city level among other possible contexts of the health in all policies approach. These two types of approaches are quite important for ensuring population health. And the healthy city particularly, the health in all policy particularly, take into account the public policies across sector and look for synergies for synergies to avoid harmful impacts on health, to accountability, consequence of public policies. And we are very pleased to have here also Professor Pekka Puska, which is there, who is one of the main actor of the healthy in all policy approach back in Finland years ago and in WHO afterwards. So this approach has been quite popular, but very difficult to put in place. And the healthy city is actually one of the mechanisms through which we try to put this in action. And I have to say that in Qatar, the National Health Strategy, which has been approved a few months ago, is putting healthy city as one of the main pillars of this agenda. And so in our discussion this morning, we will first look at the health in all policy approach as the context within which we operate, where we will look then at the healthy cities way in which this healthy city approach is actually applied. And finally, we will look at Qatar, having the experience of Qatar through the Qatar Green Building Council contribution. So let's go to the core of this session, and I would like to invite to the floor Dr. Carlos Dora. Carlos is a friend and a colleague who has been working in WHO, who has worked in WHO for many years and with different responsibilities. He's now visiting professor at the Columbia University in New York. And he has been very much involved in all the activities of promoting the inclusion of health in other policies, through in transport policies, in the green buildings, in the green cities, in energy policies, in many other aspects. And I think is the best suited person to remind us all the various aspects of the health in all policy approach. Carlos.
Thank you, Roberto. Enormous pleasure to be here. I've been to Qatar last time, it's already 6 or 7 years, so I've seen a completely different place. And I think it's not only a beautiful place, but it's also a place that because of the speed of growth in urban development, creates a number of major opportunities for public health. And I think that's where I'd like to focus, because I see, although maybe the concept of health in all policies is is broad, but the rubber hits the road and the reality comes to possibilities. when you're talking urban development and the policies in the urban environment. But I start, how is it that I come from being a medical doctor and working with WHO for many years, and I'm an internal physician, really, I reveal here, and I've done proper clinical care, but I've come gradually to realize the importance of those issues, and I have focused increasingly on them. And the fact is that we now know, this is WHO data, that a quarter of the burden of disease is due to environmental factors. And they're all amenable to change. So if we change our environment, we're reducing a quarter of all deaths, and this is mortality. So it's not a small piece. And the diseases that we're talking about are the most frequent diseases. Strokes, heart disease, now a lot of evidence coming up on diabetes, for example, and its impact from air pollution, as well as cognition and dementia. So there's a lot of new evidence, and this is very solid evidence that exists already. And I'm coming right to the blood vessel. This is air pollution, is the new, I'm just coming from organizing the first global conference on WHO, because we now know that air pollution kills as many people as tobacco over the world. And this is a major thing because the health sector hasn't yet responded to the level that it would be required to address that. And the kinds of changes in the vascular system that occurred from air pollution are very similar to cholesterol or to hypertension. So it's the actually thickening of the blood vessels that ends up blocking and causing heart disease and strokes. And there's a couple of lungs, just to say that the environment has to do with our body in a very intimate way. The lung on the left is a lung that has been breathing air pollution. The one on the right is breathing tobacco. The difference is there's the same kinds of pathological changes, much more in the tobacco lung, but the lung on the left is also a lung of children, people who don't smoke, and who actually, in reality, end up having exposures of that kind of pathological factors. So because of everybody breathing air pollution, we have almost the same burden of disease, and that's part of the picture. So where does it all come from, and how is it that we can prevent this? And this is why we're here, and why the Qatar policy, the health in all policies in Qatar, where they can contribute. I'll start with transportation, and I see it with pleasure that you're having great investments in rapid transit, in metros, and in public transport. And I say with pleasure because we have very good evidence that a sustainable transport, there's a mixture of rapid transit like metro or rail, light rail, combined with cycling and walking access in the urban environment produce a lot of benefits. Less air pollution, more physical activity, less traffic injuries, less noise. So there's a long list of benefits that a sustainable and healthy transport can produce. And very few other interventions in the urban environment will produce as many benefits as a good integrated transportation policy. This is just the review of the evidence. I won't bore you. And this is to say that the conversation that we in the health sector need to have with the transportation sector, who normally has a number of other things in their agenda like congestion or, they have other concerns. We have to map where do we combine, where are the common interests. And I think that's possible. There's just an example of transportation. The other, I'll bring a few of those examples. Access to green. There's now, again, a lot of evidence that access to green produces not only mental health, and that's probably where the health is better, the evidence is better, but also in terms of reducing the impact of air pollution, because some plants absorb air pollutants, they also separate you from the polluted environments, they also create more quiet places, and they create spaces for people's interaction, which in itself is an important determinant of health. So I think here you probably have some questions, because you have a beautiful sea, you have the sand dunes, and how much is that producing mental health and all the health benefits? And I'll leave you have many researchers here. I think that's a very important question that you should be addressing in the context of your next interventions and producing evidence to the rest of the world. Mental health I was mentioning, I mean, there's quite a lot of evidence now on the urban design and the shape of cities and mental health. Housing, we just produced in WHO housing and health guidelines, which are the criteria for health in housing. All with systematic reviews, this is all very rigorous work, and this is just a summary of design in urban areas and how does it connect to well-being. And I won't go into all the details, but there's quite a lot of evidence. I can send you the slides. They can be made available. So in general, we have this map where we have public policies on the left, green space, transportation, land use, waste management, etc. And they create risks to health, and that's where the evidence that we have, you know, how much of those policies create risks and how much the risks create, you know, reduce heart disease, strokes, and diabetes, for example, prevent traffic injuries, and promote mental health. So that's our model in terms of the knowledge that we have. That's how we work with this. And Roberto has indicated exactly what's one of the best models, which is the model of healthy cities. What is healthy cities? It has technical, I'm illustrating a number of city initiatives. And I'm promoting healthy cities on purpose, because healthy cities includes the technical aspects of what is it, what knowledge we have that what works, with the networking ability, and the fact that this is a political issue as well as a technical issue. So I think more than the other initiatives, Healthy Cities puts those two pieces together in a very fortuitous way. And so they are not only a place to produce some vertical intervention for reducing hypertension, for example. I mean, they can be a place for a vertical intervention, but Healthy Cities more than that. Is how the politicians, where there's leadership, as Roberto was mentioning, that can use this information and really create urban environments that can promote public health. So I think part of what we have to do as health people who have this knowledge is to identify who our audiences are and who can take action on that knowledge. And I think obviously urban planners, transport people who are investing in housing, they are key stakeholders, but also mass media, civil society, academia, and people who have resources and who are making investments, because it's a part of the government's and everybody's responsibility to be looking at what investments, what opportunities do we have today, and how we use those opportunities for work on public health. So as a doctor, I have a prescription on that, and I like this business of prescribing. And so I think what we can do is to identify where are the health concerns, what are the real problems. Here, for example, diabetes is a big issue, obesity, it's all the non-communicable disease agenda. Then we have to map the linkages between these diseases and the risks to health, show the evidence, but also engage the relevant stakeholders in taking action, showing the actions and showing the results. Because we have in the health sector the data and the ability to demonstrate where the public interventions or like the transportation interventions, what benefits they have to health. So I would say follow the money, honey. See where there's investment, because there's an opportunity there. We have a few tools like health impact assessment. It's very well known. We can map risks of disease around the public environment. We can do scenarios. And for transportation, this is a city where we see if São Paulo was like California, like Los Angeles, was like London, or was a compact city, what would be the impacts on green is physical activity, on gray is air pollution, and on pink is injuries. So you see that depending on the scenario that you choose for your transportation policies, you could have benefits, which is the top, go above the line, or you have disbenefits below the line. And I think that kind of tool that we have available is off the shelf, is open source, can be used to develop scenarios and look into the future. This is just saying that also civil society can take matters on their hands. And this is Kathmandu, where civil society, government didn't inform about air pollution. People bought portable monitors and are reporting on the newspaper. So I think we have to say civil society has mechanisms today to engage on these discussions. But we have the data that can provide the big picture and help identify with other stakeholders in society what is the vision for a healthy future, and in the case of Qatar, what's a healthy Doha, what it should look like in the years to come. Thank you for the opportunity. Pleasure to be with you.
Thank you, Carlos. I asked the colleagues to be short because we want to have time for the discussion. And so now I would like to, let me point out one thing. I mean, what Carlos was pointing out is quite important in my view. I mean, the fact that we have the information and we have the data and we have the evidence of all these connections and the links. So we need to translate this evidence in policies, actions. So we need a lot of leadership to do this, to make this to happen, because it's actually complicated to work also with the health sector on this particular domain and with the other sectors which are not very much familiar with these connections. So we have also to realize the context, the limitations, the problems that we have, the language. Yesterday there was an interesting session on NCD and nudging, and we were asking ourselves at the end of the session, how do we nudge policymakers? Which is actually quite an important concept, because to translate this type of knowledge into actual action and leadership. So now we have seen the general principles, the evidence, the tools, and now I would like to give the floor to Mr. Murat Ar, who is the director of the Turkish LTCTs Association. Dr. Murat has been very much involved in city government, urban design, and things like that. And he has a long experience, and he's the leader of the, I would say, one of the largest LTCTs network in Europe, right? I mean, there are many cities that we will see who it is. So we asked him to tell us something about how they work with the cities and how the cities are acting to improve the health of their population. Dr. Murat, please, you have the floor.
Thank you. Thank you, Dr. Roberta. Good morning to everybody. It's a pleasure for me to be in Qatar, and thank you to Dr. Roberto and his colleagues for inviting me to this important innovation conference in Doha, Qatar. My name is Murat. I am the director of Turkish LTCTs Association since 2014. I am also WHO European LTCTs Network. I'm the National Network Coordinator of WHO European LTCTs Network, and last October in Belfast, I'm honored to elected as a member of Advisory Committee of WHO LTCTs Network. My presentation outlines are a short information about Turkish LTCTs Association, WHO LTCTs Network, activities of Turkish networks such as trainings, publications, competitions, and awareness projects. Some good examples, some good implementation examples from our member municipalities, and during our activities, obstacles and difficulties that we met. In Turkey, LTCTs movement has started early in 1990s by Ministry of Health, but after a while, it's understood that it will be better approach to be a union of cities or union of municipalities. We are a union of municipalities in Turkey, and we have been established in 2005. In the beginning process, only 10 municipalities have participated in the establishment process, and they prepared the strategic plan of the network and also legislation of the network. And by the year 2018, we reached to 72 members in Turkey. And I would like to share the locations of our members in Turkey. Our main goals are to introduce and popularize the WHO Health Justice movement in Turkey and create awareness about it, to represent our country effectively and powerfully in European network, to work on urban urban health and effects on factors on urban health under the guidance of WHO, to prepare reports about these studies, to guide for members, municipalities by consulting, to provide information and experience sharing among municipalities, to transfer sustainable development goals to municipalities, to support for works about decreasing inequalities in cities and creating health cities. Of course, one of the main goal is to put the health issues on the agenda permanently, agenda on the mayors and the decision makers of the municipalities. Our activities are trainings about topics related to urban health, trainings on city health, how to prepare city health profile trainings, trainings about urban carbon footprint inventory and sustainable energy action plan, to arrange project competition among member municipalities, publications, and works about awareness and campaigns. In WHO European region, 30 countries are participated, and 21 of them, which you can see on the yellow countries, are accredited members of WHO. And fortunately, we have been participated in this network since our establishment, 2005. And Green are in the process of being accredited. They are trying to establish an association such as our association, Union of Cities or Union of Municipalities, or it can belong to Ministry of Health. Some details about our activities. We are trying to encourage our member municipalities on two topics especially: how to prepare city health profile and how to prepare urban carbon footprint inventory. And we are trying to explain how important the urban health indicators to be a healthier city. I mean, to see especially the decision makers improving or how things going worse, to see and prepare their strategic plan and action plans according to this especially two examples. And we are encouraging them by giving certificate. Our publications are especially on the left part, you can see urban health indicators for Turkey. We tried to be an example to our member municipalities. We calculated approximately 75 indicators. We wish to increase this number of indicators to show how the indicators must be calculated and how you can use them. So we compare between the cities in Turkey, 75 urban health indicators. Also, we have evaluated these indicators according to the European Union average or according to the OECD and world average. Also, we have quarterly magazine called Citizen. Every 3 months we publish. On each we release a different topic about urban health. And of course, we are trying to translate WHO, especially the WHO publications to Turkey and deliver to our member municipalities. And conference books, we arrange conferences approximately 3 or 4 times in a year, and we prepare the full case studies of these conferences in a book. And we arrange also a contest between our municipalities, and we also put all the projects in a publication. We discussed Dr. Roberto to talk about an example about how we measure an indicator and how we explain to our members. I especially choose one of the sulfur dioxide about concentration, because air pollution is one of the main topic in Turkey, like many cities, especially high density of population. We have also very crowded cities in Turkey, like Istanbul, and the second and the third. Istanbul has a population approximately 15 million, and second and the third biggest cities have the population like 6 to 7 and 4 to 5. I came from Bursa, which is the fourth biggest city with the population of 3 million. In this situation, there are many cars, many people using fossil oils, and there are many reasons to have an air pollution problem. So in 2013, we published this indicator. Next year, we plan to update this, so it will be more indeed concrete example after the new release of this publication. I may explain, but according to this map, 20 cities, we have 81 cities in Turkey, and 20 cities are over the limit according to the European Union limits. Of course, after this publication, we delivered this publication to all our members, to all cities, and as we shared also with the ministries, and we discussed how to decrease this problem in the cities. And you can imagine, as Dr. Carlos mentioned, to how to decrease the traffic problem in the cities, to encourage for biking policies, for encourage people for walking and public transportation. Some other details about our projects, activities. We arrange every year a Healthy Cities Best Project Awards, and every year we organize this to develop this contest, to develop successful projects and disseminate them to the whole network. This year it was the 10th contest, and 32 members have applied with 91 projects on healthy urban planning, healthy environment, healthy life, and social solidarity categories. We have a jury of academicians. We have some also awareness projects that we would like to repeat many times in a year to make awareness to our members. We arrange a workshop between our member municipalities for entitled "Bicycle as an Active Transportation Vehicle." Also, we arranged a campaign to go to school with the children with bikes, and we try to disseminate to this project to our member municipalities. Also, a voluntary group of biking group with the different ages biked from Bursa to Denizli. It's approximately 468 kilometers between 5-6 cities, and by visiting mayors, they try to make awareness about this project. I will tell short information about the last year's awarded project on the left part from Izmir city about Healthy Life project, and it's an European cycling challenge. The other one is from Istanbul about monumental trees, healthy environment category. On the social solidarity category, game does not recognize obstacles, which is also disabled children participated in this project. And the last one is from Ankara Çankaya municipality, adaptation to climate change through rain harvest. Of course, we have many obstacles and difficulties during our activities. The first one is difficulties to obtain data, and the other one is low number of cities preparing city health profiles. Unfortunately, only 17 member municipalities has prepared this work. And lack of educated understanding of urban health indicators and the inability to compare improvement and worsening indicators. Collaboration with ministries. We have a collaboration with especially a Minister of Health, but we try to improve the collaboration between them, and we want to strengthen communication between ministries and municipalities. And we have another difficulties about to spread this movement to all Turkey in as you have seen on the map, we have most members on the west part, but we want to spread it to the east part. Thank you.
Thank you, Dr. Murat. I mean, I think we have seen, I mean, how how large is the range of activities that the LTCT network in Turkey has done. And he's also mentioning one of the big challenges that they have, and there is everywhere, I think. I mean, the need to have data to show progress and to show that the various activities have actually improved the health of the population, which is a big challenge because we need to define the proper indicators in order to measure directly or indirectly what has been achieved by these activities. So we went from this journey started in the overall set of principles at the global level. We focused then on Turkey, and now we come to Qatar. And as you know, we have LTCTs and LTNOL policies as one of the objectives and the targets of the National Health Strategy. And I'm very pleased of the presence of the engineer Meshal Al-Shamari, who is the director of the Qatar Green Building Council, and he has been director since 2012. And this is an organization which look at developing a culture of sustainability for Qatar, particularly in the area of housing and buildings. Please, Dr.
Very good morning to you. I think I'll take you to different sectors from the cities. We'll go to macro level to buildings. Briefly, Qatar Green Building Council is a member of Qatar Foundation, established in 2011. And our mission, vision is to create the awareness and promote the concept of green buildings in Qatar and in the region as well. That's through the leadership, through our own programs, and as well through the collaboration with other organizations in Qatar. Our mission also is to raise and foster the awareness about the green buildings and environmental sustainability as well in different sectors, in the level of the professionals, academics, and as well the community. So why we focus on the building sector? Actually, 60% of the generated energy in the world goes to the building sector, which we consume in our daily life, either in schools, homes, universities, office buildings. So this is a big consumer of a major resources that we produce in the world. And actually, besides that, more than 90% of our life is in buildings, whether at homes or at office, wherever it is. Even transportation systems that we transport between building to a building is also considered part of the green buildings. The development of green buildings actually was a recent in the world. It started in the 90s, developed over the last 20 years. The focus at that time was to reserve or conserve the consumption of energy and water, and waste also management is part of that process. Through the development of the research sectors and also the professional measurements of the benefits of those buildings, we found benefits beyond saving energy and water. And actually those factors, they are just 2 to 5% of the resources that the organizations spend on. I think 80% of the resources that the organizations pays for are the employees' wages and salaries, having a good environment for those employees and increasing their efficiency is a big income or benefit to the organization. So imagine a bank, employees' performance increased by 10%. That's really a very big revenue to the bank. So scale that to universities, schools, well-being also at hospitals, universities as well. So there are so many we can say implicit benefits for those buildings beyond saving water and energy. So since we are in WISH, so we'll focus on the health benefits. So actually, research shows that 93% of the tenants or users of green buildings are satisfied in compared to 85% of normal or traditional buildings. That 8% or 10% increase in satisfaction, or having more better buildings in regard to health or well-being or satisfaction, indoor environment, air quality, type of materials, so toxicity for the materials that we use in those buildings, having a very strong impact on the users or employees that are using those buildings. So, as we said, the increasing pollution levels in the world because of the CO2 emissions and also other pollution factors make it mandatory to live in healthy buildings. So many people think that being in a building is safer than being out of the building. So, but the actual fact is buildings sometimes can be polluted more than the outdoor. So indoor you will have the sick building syndromes, pollutions, the bad air quality have an impact, the materials themselves, even the temperature controls or level of temperature, natural lighting, level of lights that impact the tenants of the buildings. So many factors within the buildings make it really very critical to measure and make sure that those factors are very safe for us to be in. So to talk about Qatar and the development of the green buildings, we have started in about 12 years with Qatar Foundation projects, actually being a pioneer or leader to foster or lead that concept or development in Qatar. So now in Qatar we have the second largest number of green buildings in the MENA region, with the LEED certification system, which is leadership in energy and environment design, developed by the US Green Building Council. We have about 230 registered buildings, plus having not only the second largest number of green buildings in the world, but we have a really very iconic buildings and world records in Qatar Foundation. For example, we have the largest number of LEED platinum certified buildings in 12 buildings in the student male and female housing projects. Also, we have Mishair Properties project, which is in completion. I think within next year we'll have 100 LEED certified buildings within platinum and gold certified buildings. That will make it the biggest compilation of LEED certified buildings in the world. Also, we have another rating system in Qatar, which is GSAS, which is used in the World Cup stadiums. All the stadiums will be GSAS certified. Plus, Lusail City, in its completion, will be one of the largest sustainable cities in the world. And we have different buildings that been using green buildings practices, whether in Ministry of Awqaf, Ashghal projects, municipality also projects. They all follow the green buildings requirements. So actually, as Qatar Green Building Council, our role is to support and Qatar in its journey of moving from depending on the fossil fuels to renewable energies, and also to promote and change actually or create the culture of the sustainability in Qatar. So we'd like that in the near future to be part of our culture, part of our daily life, and part of our lifestyle. As we mentioned, it's not only about saving water and energy, it's beyond that, it's lifestyle. So most of our activities goes around that concept. So we do research projects, which is one of the basic elements that we do in either applied science or academic projects. Also, we do outreach programs through education, raising awareness, and also education for professionals. And we have developed so many programs in that field. For example, like for the 4th edition of Qatar Green Building Conference, which is one of the unique conferences in the region that focus only in green buildings, development and environmental sustainability. Qatar Sustainability Award, which is an appreciation event for all the projects that really deserve appreciation, and also support the initiatives or projects that support the Qatar's journey toward being a sustainable country. Green Life program, which is, I think, the first loyalty program related to a healthy lifestyle. So it's not in sustainability. So it's beyond that. So we want the sustainability to be implemented in all our daily lifestyle, either being healthy, doing sport, outdoor walking, recycling, reducing consumption of production of waste. And also Qatar Sustainability Week, which is full of activities during a full week. We reached this year to about 30,000 participants in the Sustainability Week. Every year the number is increasing, so that's the main program that tried to raise the awareness about sustainability in the community or in public level. So we don't want the sustainability or environmental sustainability to be only in the academic and professional level. It's everybody's role, everybody's lifestyle that can do. We'll not wait for governmental regulations to, for example, to make a recycling project or waste management project. We can do that from home. We can do so many initiatives. We had school projects, competitions, beach cleaning programs, so many awareness sessions, workshops. That was full of activities from academic or professionals to even school children. Also, No Paper Day, one of the activities, Qatar Green Directory. It's one of the leading projects that tried to connect the industry with the consumers. We found a gap between the producers or the agencies of green products and difficulty to reach to consultants or even public. So that platform lists most of the available green products and services in Qatar, and it's very easy engine to search engine tool to approach or to find those materials. And also EcoSchool is one of the leading projects that we launched this year also. This program has about 90 million students in all over the world. So we became partner with that program. So this program makes the school the hub to spread the awareness among the student in the school itself and also in the community. And Green Key, it's a certification system that focuses on the hospitality sector. This year, we certified 2 hotels. Our target next year to certify 15 hotels in Qatar, which is also a leading program to promote sustainability in the hospitality sector. And also the education programs that we work with. Qatar Sustainability Week started with about 50 participants, 100 activities, and 10,000 participants. This year, we reached out to 700,000 people in Qatar, 30,000 participants, more than 210 events in the country, in the state of Qatar, from the north to the south. Those are the activities that we did in Qatar Sustainability Week, as I told you, mostly making sure of the engagement between the community and the organization in Qatar that work in the sustainability field. So it's everybody's role and part to participate with. This we have achieved also this year as training programs and conference attendance to 1,400 delegates over the past 3 years. Training program is one of the essential and important topics that we started with. We started with 3 topics in 2.5 years. Now we have reached to 29 topics in professional training programs. We have trained over 4,500 professionals and experts in the sustainability and green building sector. And the Sustainability Award, actually, since the start of the award, we thought we'll have limited number of awards, or the awards number or initiatives and even projects decrease every year. And actually, we found it increasing. For example, we start with 83 submissions in year 2016. This year, and even after the blockade, we have more than 135 submissions for the award. And we were glad to see most of the materials, production, recycling products, all available in Qatar and produced in Qatar. Thank you very much.
Thank you very much, Dr. Meshal. Can I invite the speakers to the panel here? Okay, we had a very nice overview, I think. Also, the last presentation of Dr. Meshal with all the progress which has been made in Qatar is very interesting. I'm sure there are questions and comments from the audience, so please, the floor is open.
Thank you for nice presentations. My question from Dr. Murad, Healthy City in Turkish. As it's multi-sectoral issues, how do you coordinate, or what are your specific challenges in coordination of all sectors involved in Healthy City?
Okay, let's see if there is any other than before you. Any other questions at the moment? Yes, please.
So, thanks very much. Aziz Sheikh from the University of Edinburgh. I'd be interested in knowing about what data you have available here in Qatar or in Turkey around evaluating the impact of your initiative to improve air quality. Because in the UK, we've been able to link health data with pollution data and meteorological data, so we can then begin to evaluate the impact of these policy initiatives.
Okay. Professor Walid?
Walid Kronfle, Director of Research and Policy at WISH. I'm wondering if here in Qatar there are plans, or maybe you've discussed things in the past about implementing programs at the high school level so that you can change behavior and inculcate sort of physical activities so that to reduce some of the non-communicable diseases like diabetes, for example.
Okay. There is another question here, then we have a first round of answers, and then we go to the next.
Layla McKay from the Centre for Urban Design and Mental Health. We've been getting lots of emails recently about the model of green space for mental health, of which, of course, there's lots of good research from desert cities and cities that essentially have, challenges with maintaining green and perhaps different interpretations of what green might mean. And I was just interested in your reflections on that from the Qatar perspective.
Okay, so we can start with Carlos about this last issue on mental health and green space that you mentioned in the presentation.
Sure. I think there's a lot of very exciting evidence, including from your organization, in producing how is it urban design links with mental health in a number of issues. I haven't seen any evidence specifically on access to the leisure and space, which is gray or sort of sand color. But I think it would be interesting to cover that. Just out of the people who have been talking, I mean, many people go to the desert in the evenings, and there's something to do with social connections. And that's one of the functions of green spaces, is actually to be able to mix and to meet with other people. So I wouldn't be surprised if there was a positive impact. I don't think it has been documented, and I think there's opportunities here to document. Equally, there's more evidence on green space than in access to blue and to sea or other waters. But in the same spirit, I think you could expect that this could also have an impact. I would say, however, that there's some traditional, in terms of green buildings, I think you haven't mentioned, but there's some traditional architectural ways of collecting the dust, which is through different water pools, etc. And I think you have to think of that element, because coarse particles have a negative impact in respiratory disease, and it's part of air pollution. So you have to see what are the mechanisms that you use to take care of that. But I think it's interesting research area, basically.
Yeah, this is one of the many research opportunities we have here in Qatar, and I will mention something later. Please, about this issue of the data and the connection with health. And
yeah, actually, you touch a very good point, and in Qatar we have now the first well-certified office in the region, I think. Now, beyond the green buildings, there are certification systems goes to the well-being within the office spaces, and that also goes to any other kind of building. I think there was a study in 2016 by Harvard School about the impact of well-being on the mental ability also, which showed a very good results of having that kind of environment, indoor environment. And actually, I think when we talk about air quality, level of toxicity of materials used, lead levels, and all those factors, for sure will have an impact. And also part of the green buildings, as Dr. mentioned, is the evaluation or measurement of all those factors, either during the construction, how you control all the HVAC systems, the filtration system, the air quality, temperature control, natural ventilation as well, natural lighting, and all those factors, as research have had an impact on the mental abilities.
About the collaboration among sectors in Turkey?
Yeah, between multi-sectoral factors, we are trying to make coordination, such as we are public institution, and we try to use this benefit to contact to especially Ministry of Health and Ministry of Environment and Urban Planning, and we are trying to arrange a platform when we invite also these two ministries, representatives from ministries to our platforms to discuss the issues between our municipalities. From each member municipality, we have 4 contacts. One is mayor, the other one is the elected 2 councillors. These are the politicians, and the other one is the coordinator, who is from different kind of professions, such as urban planning, architecture, landscape design, or maybe a doctor. And we are trying to combine these all professions in the same platform. Beside them, we also search for the NGOs, stakeholders, who is working, studying on which topic we are working on. We are trying to invite them, and also private sector. We are trying to combine them together and try to discuss and see what are the problems and what can be the solutions.
Comment?
One more thing. Sorry, I must add it because we have an advisory committee, 11 members we have, and this 11 academicians are, each of them are from different universities, different departments: urban planning, architecture, ecology, public health, especially. Yeah, this one, the last say.
I would just make a comment on the data,
Yeah.
and on the children. And I think there's a lot of people thinking and moving, and I think Qatar is included in thinking what are cities that are good for children, also good for older people, as a way of clarifying that, what would be a good city. And if we're thinking of the future, especially in terms of urban infrastructure, etc., I think children is and adolescents are a very good group to think of that. And the way that there's a number of ways, but documenting and using the health information data to inform about what's a good city for children or for older people, it's one of the ways that I think you can influence, partly because there's trade-offs. You do one thing, like you're saying, let's do physical activity. Now, you want to make sure that the physical activity is done, let's say, the way to school. That environment is safe, for example, from traffic injuries, that you don't have a polluted area, that the children or adolescents are walking in areas where the air is reasonably clean. So it's in a way, if you think of a population group like children, you should be thinking of the various, what's the combination of, factors that would allow children to thrive and to develop. And I think that's a very helpful way of looking at the future of cities, which would include stimulation for physical activity, but in the context of other risks as well.
Yeah, I just wanted to add a point on the data. And, we, as you know, in Qatar, as in many other countries, but here in particular, we have the problem of putting the data available in contact with each other. So we have different institutions who collect information on different domains. Now we have established at the Ministry of Public Health an observatory which tries to connect the different institutions and try to get data for informing public policy. And one of the projects we have just started is actually to look at the impacts of acute air pollution, short-term air pollution on health. We're using both mortality data, but particularly hospitalization data. We have a tremendous database in Qatar, which is the registration of all the hospitalizations and also all the visits at the primary healthcare corporation. Of course, it's only the public sector, and we don't have data on the private sector. This is a problem. But we will try to make this, we'll try to demonstrate, to show the connection and how much the connection is actually present in Qatar, because you have a different quality of the air pollution due to the presence of more natural component with respect to anthropogenic component, although the anthropogenic component is there and is significant, but we need to see whether we have the same risk function that we have observed in different cohorts in the world. Recently there's been a publication who has accumulated all the different data and provides new risk estimates. So there is a process going on. It's not an easy task, but we have initiated it after a long gestation. Right, we have several questions. Yeah, that's helpful. Yeah. So you have a question here, yes, and yes, please. And then
hi. Here, okay. Hi, Liz Grant from University of Edinburgh as well. And it's picking up what you're saying about children and the importance. So 2 questions. One, how do you actually engage children in this conversation so they're part of it? And how in our curriculums can we add components in? Because Carlos, when you were talking about the stakeholders, we didn't have educational groups as one of those key stakeholders. So I'm just wondering what your thoughts are. And it's great to hear, the eco school movement that you hear is extraordinary right across the globe. But how can we build that into our conversation here?
Hi, I'm Don Berwick from the United States. In my country and many others, there's a vast overinvestment in hospitals in the acute sector compared to public health. I'm interested to know if you have examples where the hospital sector has stepped up to lead this effort, or has it generally evolved in parallel and separately?
Hello, I'm Noor. I have ABS in environmental science, so I'm very much interested in green buildings. First, my question is, when does usually Qatar Sustainable Week take place, and is there a specific date for 2019? My second question is, your projects are for the newly created buildings. Where about the old buildings in Qatar, especially that we know, maybe because of the weather or the lifestyle, most of the buildings have those small windows, no balconies, etc. So do you have any plans for the already built ones?
Thank you. Good morning, everybody. I just wonder if there are any indicators of what's the area of the green should be compared to the area of the city itself, and some kind of these indicators which we use. I mean, in clinical medicine or public health, you use that how many doctors per population, how many nurses, how many beds, and so forth. Are there any similar things for this? So we can
for the greens, the impact of green space.
Green,
yes,
all the indicators which
sure.
we talked about.
Yeah,
thank you.
Absolutely. And last question for this round over here, please.
Hi, this is Fadi Maki from QBIU, Qatar Behavioral Science Unit. Just wanted to address some of the points on nudging policymakers and stakeholders. I think there's a lot of room, especially if you have data. I mean, there might be some structural issues for people not sharing, but assuming there aren't, which I think is the case, there's a lot that you could do with behavioral science to encourage people to share data. Implementation intention, pledges, using social norm, telling them where their trends. So there is room for bringing in some of the data that you say is with the private sector, other stakeholders, to create a more informative kind of policy.
More evidence-based.
We're happy to help in this.
Yeah. Okay. Do you have a question also? Yeah. Okay. Let's.
Thank you. It's a brief question. I'm Vilma from Argentina. I work with the University of Buenos Aires and our government at the national level. And my question is, if you have data on both the healthy cities in terms of the environment and the physical activity promoting environment and the food environment, because we are very much interested in studying the interrelationship between them, the food environment and the physical activity promoting or not promoting environment. Thank you.
Thank you. Okay, we have a number of very interesting questions. Carlos, you want to start with the children and the involvement of children?
Sure. I think this is where some of the exciting examples are. And in schools, you're quite right. I mean, it has a very important role to play. I can tell that I've seen some mayors giving space for children to engage. For example, there's one mayor that puts children in charge of the city for one day in the year. and he finds that there's some very interesting ideas that come out of that. The other is to give children a say in terms of how public space is going to be used. So there's been a collection of, and we're actually thinking of doing more work, more focused work on that. I have a workshop in New York where I'm a professor very soon on that, on the evidence for that. But I think there's loads of good experience which necessarily have not been put together, but I think we're at the right moment to do that. And I think that's having that as a vision is, especially I'm coming back to the data and to the legacy. The data exists, and somebody was asking about the pollution data and how much green space. Well, we don't know how much green space, but we know that the quality of the green space is very important. And sort of a green space which is well taken care of, that is not derelict, it's attractive to people, and that has a meaning. Whilst green spaces which are not taken care of are a risk and something to be avoided. So I think there's more knowledge on the quality. But I think that overall, in terms of using the access to information that was raised in terms of the nudging, there is increasingly big data and access to data from elsewhere. So we have very good data for air quality in Qatar and in all countries in the world, partly produced by the country, partly produced by satellites, partly produced by air quality models, air quality transport models. So now there's a lot of access to information which doesn't depend only on the local level. So I think that's a help, because there's a stimulus to produce better information locally, and I think that creates a positive dynamic. So I'll stop there.
For the hospitals and
eco schools.
It was a question about whether this green building council is also looking at hospitals. And
Yeah. And
all buildings and hospitals.
Actually, there were two questions. One about the Eco School program, which is launched this year. Actually, now we signed an agreement with Kahraman to fund the development of 6 schools for this semester, and next semester will increase the number of eco schools. We have about 50,000 schools around the world part of that program. Inshallah, we'll try to engage most of the schools after making the agreement with Ashghal also to fund more schools to develop. And the aim of the program is to make an engagement between the student themselves and the development of their school. So the student will make that movement or development within the school. The other question is about the old buildings. Yeah, actually, this is very challenging. Actually, most of the new buildings are having the best technologies now in regard to mechanical systems, specifications and materials. We have in Qatar about 120,000 buildings which are existing, and the challenge is to retrofit those buildings. And the green buildings concept or rating systems already consider the existing buildings, so we have that sector. But the problem is having the full ecosystem, which is mainly the funding or the regulations to fund those buildings. So we started with the hospitality sector, with the hotels, and the green key certification systems target the new buildings and as well the existing buildings. So we started with about 15 hotels now as existing buildings, and the aim is to develop them and make case studies out of those projects, and to demonstrate the achievements or the increase in efficiency, saving in energy and in their monthly bills, and have a real demonstration about that movement. Till now, unfortunately, we don't have regulations for the existing buildings. Even with the renewal of building permits, it's still in Qatar. It's one-time building permits. You cannot renew it every 5 years or 10 years to make sure that you follow the latest standards. So that's still challenging, but we have created, or we have developed a certification system for materials that can be used within the retrofitting of those buildings, and will be launched by next month. So hopefully that will help also.
I mean, there was a question about the involvement of the LTCT in other, dimensions like the food environment. Is there something that you have been doing on that?
Yeah, very good topic, because we have a lack of knowledge about this issue, food environment between physical activity, related to physical activity. We have some publications about, but we don't have a concrete example between. Of course, we know the risk of obesity, especially in the childhood period. And as I mentioned in my presentation, we are trying to encourage our member municipalities, especially for children, biking policies or for increasing green areas. But we would like to make a really serious research about food sector. I mean, because as my country, I must say that I think we lose some things. Some cultural foods nowadays. We mostly eat like fast foods, or some maybe not clean or fresh things. That's a big issue to make a research about. And then after Carlos, so Robert, I missed the gentleman's question about what health data for evaluation from UK. I think he asked. May I give a short answer to him?
Yeah, sure.
Yeah, your question. Yeah, to collecting data on mostly health issues are mainly on the authority of Ministry of Health, and such as environmental issues on the authority of Ministry of Environment and Urban Planning. They share their data mostly through their websites, and we are trying to inform our member municipalities as we get the data. We especially make our research 5 years, but if a member municipality asks for a evaluation of their city health profile, we help them. We help them what they must calculate and what they must update and what solutions they must produce.
Okay. All right, so I think we need to close the session and give you time to go to the plenary hall and listen to Michael Phelps. And let me just say a few words of tentative conclusion, from the discussion. I think that what came out from this conversation and also from the question is that we need to connect and use what is available, which means the data, the policies, the initiatives at the different levels. I think this is, and we need to involve in full the other sector in this process. That's a most difficult thing to do, and in order to translate the evidence into action. If I may, I would like to suggest that in the next WISH conference, we continue this conversation, and maybe we try to more actively involve other sectors. To have a session in plenary in which we have, the energy sector, the agricultural sector, and so forth, in which we can really have, a better understanding of what they need, or what they want, or what they know already with respect to the impacts on health of their own policy. So I think, and what I think is the last word I want to say is that I was very much impressed with what the Qatar Green Building Council has been doing, and also in Turkey and other countries. So I think we need to make visible what is being done also. That sometimes we don't know that many things are happening. Your certification of hotels, for instance, should be on the booking.com. That people knows that I want to go to a green hotel, or I want to go to a green school. So there must be more action to make visible what has been done, which in some cases in this country, as in many other countries, including mine, original mine, Italy, people don't know. There are a lot of good things which are done, but they remain in the very close circles. And I think this is an important message. To make what has been done visible, and to make the evidence visible, so in order for action to be undertaken. So thank you very much to all of you for attending this session, and I wish you a nice continuation of the conference. Thank you.